Good evening, everyone. Welcome to Karolinska Institutet and to this lecture on psychedelic drugs in science and medicine. My name is Gustav Nilsson, and I have the pleasure today of welcoming Dr. Robin Carhart-Harris. Robin is a pioneer in reopening the field of research on psychedelic drugs, using brain imaging and investigating the potential of psychedelic drugs in psychiatric therapy. Robin is going to talk for a little under an hour. We will then have time for questions and discussion, and we'll finish at 8 o'clock at the latest. The lecture will be recorded and will be available online afterwards. This event is possible thanks to the Swedish Network for Psychedelic Research. I would like to acknowledge Philip Bromberg, Hans Lindblad and Alexander Lebedev. Now, Robin, the floor is yours.
Oh, wow. Okay, well, thank you very much, Gustav. What I'm going to do with this talk is, first of all, take you through the basics of psychedelic science. I'm going to tell you about our brain imaging data with psilocybin, a compound found in magic mushrooms, also our recent brain imaging work with LSD. And then I'm going to talk to you about our recent clinical work, a clinical trial, looking at psilocybin as a treatment for depression. So the talk will start out relatively easy, and then it will get a bit harder, and then it will get challenging. And it will be quite challenging for you. But talking about challenging, one thing that I've noticed actually has made me a little bit more nervous than usual in terms of talking to you is that there seems to be a lot of sort of anxiety perhaps around this topic, and I think culturally that's quite interesting. And so I thought I'd because this is normal for me. This is my world really, psychedelic science. So it doesn't feel so controversial, but I'm conscious that it is for other people. And so what I just want to appeal to you with is an open-mindedness. And so I'll start the talk with this quote from Isaac Asimov that says, "Your assumptions are your windows on the world. Scrub them off every once in a while or the light won't come in." So if we start with that kind of approach, I think we'll do just fine. So let's start with the basics. What are psychedelic drugs? So when we're talking about psychedelic drugs, really we're talking about classic psychedelic drugs. The prototypical psychedelic is LSD. The term psychedelic was only coined after LSD had been discovered, and it was coined by British psychiatrist Humphrey Osmond in conversation with the famous British writer Aldous Huxley. And so these individuals were trying to come up with a suitable term for this class of compounds, and together, really it was Osmond, he came up with psychedelic, which is a term which borrows from two ancient Greek words, psyche for soul, most accurately, and the other word delic is related to making manifest or making visible. So by definition, according to these individuals, and this has really become the adopted term both by scientists and more broadly, psychedelic, by definition, this means that these compounds are mind or soul revealing. So LSD is the prototypical psychedelic. Other classic psychedelics include psilocybin, which is found in magic mushrooms, and also dimethyltryptamine, which is found in widely in the natural world, but it's a major ingredient, a major psychedelic ingredient in the Amazonian brew ayahuasca. Now, what's striking when you look at the molecular structure of these compounds, we can see psilocin, which is the metabolite of psilocybin. It's the compound that works on the serotonin system, as I'll describe in a moment, to produce magic mushrooms and psilocybin's psychedelic effects. But what's striking when you look at these compounds' molecular structure is how similar they are to a naturally occurring brain neurotransmitter, It's found widely in the body. Most of it's actually in the gut, but in the brain it serves a range of different important functions, including sleep, mood, cognition. And so it's interesting that psilocin and DMT and these other classic psychedelic drugs share this similar structure to serotonin, and that really hints at their mechanism of action, how they're working in the brain. So how are they working in the brain? Well, one key principle that we know is that a particular serotonin receptor is fundamental, is key to the action of these compounds in the brain, and that's the serotonin 2A receptor. You can see it expressed here very heavily in the cortex. This is a PET image. Much less in subcortical regions, but it's been found that there's a strong positive correlation between the affinity or the stickiness of a psychedelic drug for this particular serotonin receptor and its potency. So, for example, LSD, an incredibly potent psychedelic, has a very high affinity for this serotonin 2A receptor, and these psychedelic compounds, like serotonin itself, function as agonists, so they stimulate this particular receptor. Now, it's also been found that if you block the serotonin 2A receptor with what we call an antagonist, a blocker, and you pre-treat with one of these blockers, then essentially you'll significantly attenuate the classic psychedelic effects of a psychedelic compound. Okay, so those are some basics. Why should we, as scientists or clinicians, be interested in these compounds? So let's start with the scientific rationale. My own belief is that they're incredibly powerful tools for studying that abstract but nevertheless important construct of consciousness. And so some interesting work in the US, which speaks to this principle, was carried out by a team at Johns Hopkins, headed by Roland Griffiths, and they found that some 2/3 of individuals who were given a single high dose of psilocybin, magic mushrooms, 2/3 of them rated their experience as being among the top 5 most meaningful, personally meaningful experiences of the whole of their lives. And so they would put this experience up there with major life events, like the birth of their first child, if they had a child, or the loss of a major family member, parental figure, for example. Some major life events, they were putting a single experience up there in the top 5, and people were maintaining this over a year on from that single experience. They also found that close to 2/3 using a standard rating scale for determining a mystical or spiritual type experience, some 2/3 met criteria for what they described as a complete mystical experience. They also found improvements in subjective well-being and life satisfaction that again endured for over a year on from just this single experience with psilocybin. So clearly these compounds have very profound and also novel modulatory effects on consciousness, and for that reason I would argue that they're powerful tools for trying to understand the nature of the mind and the brain. So what about therapeutic applications? Well, just to run through this because there's quite a lot. This work was carried out in 2006 showing some improvements in obsessive-compulsive disorder symptoms after treatment with just one experience, I think it was, with psilocybin. We've recently shown, and I'll talk about that towards the end of my talk, that psilocybin can be effective as a treatment for depression. At least we have preliminary evidence to support that. Now, an increasing number of studies are looking at end-of-life anxiety, and of course that's relevant to all of us because we all die. And so individuals given a diagnosis, a terminal diagnosis, and understandably feeling some anxiety and fear about this, have been treated with both psilocybin and, in Switzerland, LSD, and significant reductions in anxiety and also depressive symptoms have been found for 6 months post-treatment by Charlie Grove's team at UCLA. and over a year on from, I think, 2 treatments with LSD in Switzerland. So you can see that these are enduring effects, and they're also quite marked. Also, alcohol dependence. Michael Bogenschutz in the US has found significant reductions in drinking behaviors over 9 months on from 1 or 2 experiences with psilocybin. And Matt Johnson at Johns Hopkins, he's found 80% abstinence rates in smokers after 2 treatment sessions with psilocybin. So really quite striking findings, especially in the context of available treatments. But what about the limitations? What about the harms of the potential harms of this approach? Well, one particular study, an interesting approach, we can't infer too much about causality, but nevertheless, you could look at a large sample and make some inferences. So a population study looking at some 200,000 people in the US compared individuals who reported some use of psychedelics within their lifetime and compared this group to a matched group that had used other drugs that this group had used, but hadn't used psychedelics. And they actually found, and this is contrary to a lot of people's misperceptions really and opinions about psychedelics, they found lower rates of psychological distress and suicidality in those who actually reported some use of psychedelic drugs within their lifetime. Incidentally, if you think drugs are bad, this rule doesn't stand for other drugs. So there's something interesting there. You know, if we're going to try and promote and think about a more sophisticated approach to drugs, then this argues for differentiation between drugs. They're not all one thing. You have psychedelics here associated with lower rates of psychological distress and suicidality, and yet other drugs, some of which are legal, being positively associated with those things. Our flashbacks and meta-analyses have looked at this, and also surveys, including one by ourselves. They seem to have a very low rate of occurrence. Sometimes they're welcomed, actually, by individuals. Occasionally they're distressing, but this does seem to be quite rare. Also, prolonged negative psychological reactions. There's often a fear about induced psychoses. You hear about these things anecdotally. Their prevalence from surveys that we've done does seem to be higher when psychedelics are used recreationally, but meta-analyses that have looked at control studies have found again that the occurrence is very rare indeed. It's about 1 in 1,000, I think, or less. Also, reports of, in terms of more credible, perhaps, and more important side effects, limitations of psychedelics in research and more broadly, anxiety or dysphoria are actually quite common. We've seen quite high rates of this in our depression trial. Robin Griffiths has reported on this in his research. So I think, you know, that rule that there's no free lunch, with every high there's a low, the kind of limitation here with psychedelics, you could argue, is the experience itself. It's not a walk in the park. You know, it can be very challenging for individuals. So anxiety and negative effect is often seen actually in the acute state. Also, transient headaches. This is something that's been reported by Matt Johnson. These seem to last for 1 or 2 days after the experience. Quite common, actually. About half of our patients, maybe less, reported some headache afterwards, but they said in the context of sometimes decades of depression, they certainly take 1 or 2 days with headaches. So as I was saying, these effects with psychedelics are profound and they're novel. And one challenge, and I've tried to do that really by citing Robin Griffiths' work and giving you a sense really of for example, a seemingly very promising therapeutic potential of these compounds. But one of the challenges is to try and communicate to people just why this experience is interesting. And to do that, it can be useful to provide some first-person reports. And so I'll just read a few of these here. I have one volunteer from a brain imaging study, an fMRI study that we've done with psilocybin, who said afterwards that was real ego death stuff. I only existed as a concept, as an idea. Another one, this is actually from Robin Griffiths' work, says the The feeling of no boundaries. I did not know where I ended and my surroundings began. Somehow I was able to comprehend what oneness is. Another volunteer from our LSD research with using fMRI said I was traveling in the spirit world. And then a patient from our recent depression study says here there simply aren't words to describe it, referring to the acute state. There was a sense of beautiful chaos, a landscape of unimaginable colour and beauty. That's just giving you a sense of the richness of the phenomenology, but the name of the game for us when we're trying to determine or get some idea of how these drugs work in the brain to look at the neural correlates of these experiences. And so this is something that we've done relatively effectively, and I'd say probably especially so in our recent LSD research. And one finding that's quite striking has been this association between ratings of ego-dissolution. That's something I'll expand on shortly because it is quite an abstract and difficult notion. So the magnitude of people's ratings of this experience of ego-dissolution correlated with the decrease in communication strength or connectivity, functional connectivity between the parahippocampus and this retrosplenial cortex, posterior cingulate cortex region. Now, just to summarize the design, 20 healthy volunteers participated in this trial, in this study, mean age of 31 for females. We gave 75 micrograms of LSD, that's a moderate dose, and the contrast is versus placebo, which was a saline infusion, and there was 14 days between the scans, and the order of the administration of LSD was balanced. So you can see here, as I've said, the greater the split, if you want, between the parahippocampus and the ventral posterior cingulate cortex, the greater were our volunteers' reports of ego-dissolution. This was a particularly strong correlation. Now, what does this mean? Well, one way to tackle this problem, of course, is to look at the literature and look at studies that have addressed and investigated this particular circuit. And I would argue that some of the best work has come out of UCL by the likes of Eleanor Maguire, that's associated this circuit with mental construction or mental imagery, so very high level psychological phenomena. I think it's interesting then to think of the self or the ego, that thing that permeates our normal waking consciousness so strongly, as a kind of image, as a kind of gestalt, a high-level prior, if you want, if you like that prediction coding model of the mind and brain, which is, of course, in many people's views, very compelling. Also, the self, it's interesting to think of the self as a psychologically constructed hallucination, perhaps, in the same way that mental imagery could be thought of as a hallucination of sorts. Now, I was recently listening to a talk by a developmental psychologist, Alison Gopnik, who was referring to perceptual constancies. And it got me interested in this notion and the idea that the self may be a particularly high-level subjective constant. And so that tendency for the self to be stable and, of course, to be constant is something which is quite telling. It always seems to be there. So I think perhaps this circuit is especially important for that quality of consciousness, and that's a hypothesis that's, I think, deserving of some research. Also, another thing that we found in terms of the subjective experience that correlated with this particular brain effect was a particular dimension or factor within a certain quite popular and well-validated measure of altered states of consciousness, and that dimension is referred to as altered meaning. And items that make up this factor, this dimension of altered meaning, include things that, in my view, speak to that notion of aberrant salience, which is quite popular in psychosis research. And so, for example, we have an item that says, things took on a strange and alien meaning. So I think it's interesting, it's intriguing to think of what can come alongside, what can accompany this experience of ego dissolution. In a moment, I'll talk about things like spiritual and mystical experience, but also there may be a tendency, a susceptibility to what you might call aberrant salience, or finding meaning in the world when perhaps meaning, isn't, not ordinarily at least, really there and as important. So this notion of the ego is challenging. One way to think of it is that it's an umbrella construct. It subsumes a number of different things like drive, identity, personal narrative, our own story, our own background, things like mental time travel, ownership, autobiographical memory. And these personal pronouns that, again, pervade so much our normal waking consciousness are relevant here. If you were to argue, and I think you'd be hard pushed to do that the ego doesn't exist, then I challenge you to contemplate why we use these personal pronouns so much in our everyday speech. Things like I, me, and mine. Granted, this sort of sensation, this feeling of having a sense of self may be to some extent an illusion, but nevertheless, it certainly seems to colour our consciousness. Now, recently I heard someone refer to this ego consciousness, this quality of normal waking consciousness that we ordinarily have, as consciousness that has a point, that has a direction and a purpose. I found that quite interesting as an idea. Another thing that I found interesting, at a recent conference on consciousness in Arizona, Anil Seth, a professor at Sussex University, was referring to the prediction coding, the Bayesian model of brain function, and ended his talk actually with this phrase, kind of play on Descartes' phrase, I predict myself, therefore I am. So it's interesting to think of the ego as something that's reinforced in a sort of predictive way. And a good example of that kind of thing might be someone like Donald Trump. So one thing that we've been trying to do, because of course this is quite, it's abstract material, is to try and deconstruct some of it and pick it apart. And so what we've been trying to do at Imperial is develop a scale by which we can measure this phenomenon of ego dissolution. Quite hard for you to read some of this, but essentially we included 8 items that we felt spoke to this experience, and 8 orthogonal or maybe even antithetical or opposite items referring to what we have called ego inflation. We ran a factor analysis to try and endorse our assumptions, and it came out very clear that these 8 items that we felt would relate to ego dissolution did load very heavily onto this one factor, and there's this clear 2-factor structure in the data, with the other factor being related to ego inflation. So just to give you a sense of some of these ego inflation items include things like I felt especially assertive, I felt more important or special than others, my ego felt inflated, I felt especially sure of myself. And you can see the ego dissolution items, things like I experienced the dissolution of myself or ego, I felt at one with the universe, I felt a sense of union with others. And what we did was to run a questionnaire survey, a questionnaire study, sampling a large number of individuals. We'll be seeing them being out there. We looked at 3 different drugs, and of course psychedelics because they were our drug of primary interest, and then we chose alcohol because it's so widely used, and cocaine because we had a hunch that, that it might load onto the ego inflation item. And so what we ask people to do is, based on a typical experience with these different drugs, to rate, according to that typical experience, things like those items related to things like ego-dissolution and ego-inflation. You can see the result already, because the higher the dose of LSD that was part of this typical experience, the greater was ego-dissolution, nothing on ego-inflation, whereas the rule is inverted with cocaine. So the greater the dose of cocaine, the greater was ego-inflation, and alcohol didn't seem to relate significantly to these items, which I think as well is quite interesting. So it's interesting to entertain this idea. We've only looked at 3 drugs here, that maybe there's something exclusive, maybe there's something special about psychedelics. Maybe this might be at the core of why they're interesting and important, that they have an exclusive, arguably, effect on this particular aspect of consciousness, the dissolution of the self or the ego. Another thing that's interesting, and again in terms of trying to communicate to people what we mean by ego dissolution and what it's like to experience a psychedelic state, is to refer to things that they might otherwise have experienced. And so one of the qualities and scholars who've looked at the mystical experience, or the naturally occurring, seemingly naturally occurring religious, spiritual, mystical type experiences, people like William James, Walter Stace, have tended to identify both the loss of the self, or ego dissolution in other words, as a core facet of the mystical experience. But arguably, and this is based on Walter Stace's book, what he refers to as the unitive experience, that sense of oneness, is equally as fundamental. And so we had a feeling that these experiences are actually essentially synonymous, that if you're going to experience ego dissolution, naturally, as a reliable rule, you will also experience a sense of oneness. And we found, by using a validated measure of the unitive experience based on the mystical experience questionnaire that's been developed and validated, there was this strong relationship between ratings of ego dissolution under a psychedelic and ratings of the unitive experience also under a psychedelic. Okay, so in terms of what else we found in terms of the neural correlates of ego dissolution, we've also done MEG work, both with psilocybin and more recently with LSD. We found that a particular oscillatory rhythm, the alpha rhythm, that's ordinarily very prominent, and what's interesting is that it develops, it becomes more pronounced in adulthood, and it's also more pronounced in humans than in other animals, perhaps suggestive of its importance in terms of high-level consciousness. So with psilocybin, we found an interesting, highly significant relationship and selective relationship, because we looked at other aspects of phenomenology and they didn't relate to these drops in alpha power. But we found that the magnitude of the decreases in alpha power in the posterior cingulate cortex correlated very strongly with people's ratings of ego disintegration. And we found a consistent thing when we ran the analysis in a slightly different way, this time including ego dissolution as a regressor in our linear regression. And the magnitude of decreases in alpha power correlated with ego dissolution, especially in this posterior cingulate cortex region of the brain. So you could see here, looking at the power spectrum, that there's a really quite dramatic collapse particularly in the alpha band, not just in the alpha band, in other frequency ranges as well. But what seems to be important is that this drop in alpha especially relates to the experience of ego dissolution. So again, it's about sort of identifying different aspects of brain activity that relate to this very profound and unusual experience. And it's not just about trying to determine how these drugs in the brain work in the brain, returning to that principle that I introduced at the start. Really, we're using these tools, these drugs as tools in order to learn about the brain and consciousness more generally. If these aspects of brain activity and brain function are disturbed by psychedelics, and this goes with these experiences, then it suggests that the preservation of those qualities of activity and function are necessary for the preservation of normal consciousness. Now here we're looking at another aspect of the changes in brain activity correlating with ego disintegration. We're looking at functional connectivity within the default mode network, and we found with LSD that we saw decreases in the integrity of a range of different brain networks, actually. But the only one that correlated significantly with ego disintegration was the default mode network, which has been related in other studies to functions such as self-reflection, high-level, arguably human-specific cognitive functions. And then just to repeat an experience that one of our volunteers described with psilocybin, that was real ego-dis stuff. I only existed as a concept, as an idea. So this notion that the disintegration of the self or ego relates to the disintegration of the default mode network, and perhaps more specifically, that parahippocampal posterior cingulate cortex circuit. Another thing that we found that seems to go with this rule of disintegration of brain networks is something that you might refer to as a desegregation effect. So ordinarily, if we look at the placebo condition baseline state, and we look at how brain networks speak to each other, these are communities. You could think of them in the same way as brain networks or systems. Ordinarily, the communication is confined or restricted to within the community, so there's high within network communication or functional connectivity. And then you can see under psilocybin that there's much more crosstalk going on between these communities or networks. That's something that we've replicated in other analyses with psilocybin, but also more recently with LSD. So looking at global changes in functional connectivity in the brain, and seeing these regions that especially show an increase in communication to the rest of the brain under LSD. And importantly, the magnitude of this effect correlated significantly with ego-dissolution again. And just an idea to submit, perhaps this what might be described as an increase in global integrity. Granted, we see a decrease in integrity when we look at isolated brain networks, but when we look at the whole of the brain, you can legitimately describe what we're seeing under psychedelics as an increase in global integrity. If this is correlating with ego-dissolution, to think ego-dissolution is synonymous with that experience of a sense of union, a sense of oneness, just as an idea to entertain. Perhaps there's a relationship here between global integrity in the brain and that sense of oneness. Just speaking to that, you can read that quote from Robin Griffith's study, The Feeling of No Boundaries. I did not know where I ended, my surroundings began. Somehow I was able to comprehend what oneness is. Now, another way to think of how these drugs work in the brain is to look at some of the developmental neuroscience literature. And so a range of different studies, a number of different studies, have found that brain networks undergo an increase in integrity during normal development, during normal maturation, and also this process of the pastillation off of different systems, different networks that then improve in their specialization, doing their specific functions. Both of these processes increase as we develop, as we mature. And what we're seeing with psychedelics is really a sort of literal regression. We're seeing the brain behaving in a way that's more similar to an infant's brain than say, an adult human's brain. And so what that might relate to is just, again, just to sort of submit some ideas for further thought, if as we mature and as we develop, our minds and our brains become more analytical, more sophisticated, perhaps more refined, then in both the psychedelic state, like in the infant state, our quality of consciousness may be more flexible, maybe more creative in some senses, and more playful. And so, recently when we published on the LSD work, some of the conservative newspapers jumped on this idea that psychedelics make your brain like a baby's brain. And in order to kind of sensationalize our findings and perhaps, construe them in a negative way. And I would just say, perhaps we shouldn't be too hasty to do that, because one way we could think of infant consciousness, and actually Alison Gopnik's done some nice work on this, looking at certain tasks in children and actually finding that in certain specific tasks they actually perform better than adults. And I was also interested to hear from her when I met her at this conference that she's a fan of William Wordsworth, and just to refer to one of his poems that sort of speaks to the quality of infant consciousness and slightly romanticizes it, but nevertheless I think it's interesting. And it says, from intimations of immortality, heaven lies about us in our infancy, shades of the prison house begin to close upon the growing boy. And then this is actually from Alison Gopnik's one of her papers, and it speaks to this notion of annealing, and it goes as follows. Adults and children may differ in the strengths of their commitments, with children holding more diffuse beliefs. The possibility is consistent with the difference between a low temperature and a high temperature system. To borrow an analogy from statistical physics, adults have congealed in their beliefs and are hard to shift, while children are more fluid and consequently more willing to entertain new ideas. Perhaps it might be interesting to think of the psychedelic state in a similar way, that the process of annealing, a kind of heating up of the system occurs, such that there's a sort of, perhaps a kind of scrambling effect on the quality of brain activity. And that's an idea I tried to develop in a paper published in 2014 called The Entropic Brain. And it's this notion that, at least if you look at cortical activity and granted the average of a certain period of time, which would be a brain scan, then you tend to see an increase in the entropy of brain activity. So another way to say that is brain activity becomes less predictable, it becomes less ordered, perhaps in a sort of broad sense more chaotic. And this seems to be something which stands up quite well. Collaborations with Alexander Lebedev have yielded some interesting findings in terms of the magnitude of entropy that we see in the acute state being predictive of longer-term changes that you see after exposure to a psychedelic drug, specifically changes in personality. And that's something that I'll talk about as we go on. One sort of idea that I want to explore more, because I have a feeling that it's very important, is that this principle, this idea of the entropic brain being characteristic of the psychedelic state and perhaps other states that share some psychological similarity to the psychedelic state, like infant consciousness. Perhaps it's too simple as a rule. I imagine it is. And if you look at the phenomenology of the psychedelic state, it's not all chaos. If it was, then I don't think our therapeutic work would be so effective or as interesting. And I also don't think the psychedelic state would be as interesting as a phenomenon. And this is just a quote from Carl Jung: in all chaos there is cosmos, in all disorder a secret order. So one of the challenges for us, I think, is to try and identify in these metrics that we get from averaging the activity over a certain time period, whether we can isolate some signal within this apparent increase in what some people might call noise or or entropy in the brain. And then what would that relate to psychologically? Could we identify, for example, moments of insight or revelation, perhaps a recollection of a memory, something that seems to happen relatively commonly in the therapeutic work that we do. This is just quite speaking to that notion of insight within the psychedelic experience and recollection of memory. This comes from one of our patients in the depression trial, and it says, I began to see that all of my concerns about daily living weren't relevant, that they were a result of a negative spiral. I also felt that I was learning without being taught. So these might be high level of insights. Perhaps it'd be hard to isolate the neural correlates of these, but if there was something more phasic that we could capture in time, then perhaps we could identify the neural correlates of that. And so he goes on and says, that intuition is being fed. Fleeting feelings from my past came back. Fleeting feelings, whether we can isolate these somehow and look at what's going on in the brain during these experiences. Memories too, both of which seemed long forgotten. So should segue, intention here is to segue into the work that we've been doing quite recently on psilocybin in depression. And some of the literature that was motivating us to look at this, part of it came from our early brain imaging work with psilocybin, for example, looking at changes in blood flow. Very early on, we saw decreases in blood flow in the subgenual singular cortex, and I'm very aware of Helen Mayberg's work around deep brain stimulation of this region for the treatment of treatment-resistant depression. That effect sort of attenuated slightly, but was still significant in the medial prefrontal cortex as we increased the sample size. And that's intriguing because a range of different treatments for depression, SSRI, CBT, sleep deprivation, ECT, placebo, when placebo responders, deep brain stimulation, ketamine, and also meditation. Decreases in measures of metabolism or blood flow have all been seen with these different interventions for depression. And probably what's going on is that there's a normalization of an overactivity in this region, perhaps related to excessive introspection that's very characteristic of depression, that's normalized post-treatment. Also a couple of studies have found increases in connectivity, functional connectivity within the default mode network in depression. This Berman study finding a relationship between rumination scores and functional connectivity between the subgenual cingulate and the posterior cingulate cortex. Now, finding decreases in functional connectivity within the default mode networks, the opposite of that. Granted, we saw these in the acute state. The kind of things that are suggestive of psilocybin having efficacy in the treatment of depression. Also, PET work showing a relationship between serotonin 2A receptor binding and trait pessimism and neuroticism. This might be a response to deficient serotonin 2A receptor stimulation, so an upregulation of these receptors, and perhaps an upregulation because of low somatic serotonin. It's hypothetical, but nevertheless, it's sort of seems relatively logical to me. Also, we found increases in trait optimism, so related to that, if pessimism is related to deficient serotonin 2A receptor stimulation, if we give LSD and we see increases in trait optimism, that fits. LSD is a serotonin 2A receptor agonist, and so maybe this is a target for that particular aspect of depression, that kind of trait aspect of depression, excessive pessimism. It's also been found that if you block the serotonin 2A receptor with an antagonist, then the positive mood effects, or both a broad serotonin agonist, MDMA, but also psilocybin, a direct serotonin 2A receptor agonist, is significantly attenuated. So suggesting that there may be something important in terms of serotonin 2A receptor stimulation and mood that may be relevant to the treatment of depression. Other lower level work has found a relationship between serotonin 2A receptor signaling and cognitive flexibility, a positive relationship between cognitive flexibility measures and also learning. One study here, King 74, that's with LSD, finding improvements in associative learning with LSD. Also looking at markers of neuroplasticity. This study, Vaja, in 97 found an increase in cortical BDNF. There was a decrease in hippocampal BDNF, but interesting nevertheless to explore further whether there's an increase in markers of plasticity with serotonin 2A receptor agonists, and some other studies that speak to that principle. So all these different things led us to think, maybe we should be doing this. Of course, the broader story, the broader perspective with work going on around end-of-life anxiety, for example, Roland Griffith's work that I talked about early on in the talk, finding improvements in well-being and life satisfaction that seem to endure after just one experience with psilocybin. All these different things converged and gave us confidence that we should at least try this. And so we've recently completed, we're still acquiring some of the follow-up data, but we've more or less completed a open-label feasibility study with psilocybin. 20 patients have now been treated. We've looked at treatment-resistant major depression, unipolar major depression. We give 2 doses of psilocybin. We give a low dose, and a week later we give a higher dose, kind of dose that's producing these mystical type experiences and these very profound experiences that have been reported by Roland Griffith's team. He gave 30 milligrams. And we also do before and after fMRI. And actually, I never presented any findings from the fMRI work because it's so fresh, really. And but I will show you just one image as we close out the talk. So this is the most complete data that we have to date on the depression findings. So this is the QIDS, the Quick Inventory of Depressive Symptoms, being increasingly used as a increasingly well-validated measure of depressive symptomatology, and also quite easy to use. It was the scale that was used in the quite well-known STAR-D trial, looking at different treatments and secondary treatments. And you can see that most of the patients were in the bracket of severe depression at baseline. 18 of the 20, based on standard criteria, would be considered to have severe depression at baseline. Just to give you a sense, 4 of 20 were in that criteria 5 weeks post-treatment. All of the comparisons versus baseline are significant. Even with correction for multiple comparison, they're still highly significant. However we do the analyses, if we look at non-parametric tests, also the effect sizes are massive. If you put these in the context of other treatments and looking at before and after treatment effect sizes, meta-analyses have suggested, for example, placebo, the effect size is around about 1, SSRI is about 1.5, a little over, and we're seeing effect sizes of around about 3 in 2-3 weeks post-treatment, dropping to about 2 at 3 months. And in terms of standard criteria for remission, that's considered 5 and below, I think, or 5 and below on the QIDS, and so 9 of 20, so virtually half of the patients meeting criteria for being depression-free 3 weeks post-treatment. And remember, these are patients that have had often decades of treatment-resistant depression that hasn't responded to SSRIs. Virtually all of the patients have tried psychotherapy that hadn't worked for them. And then we've only got 12 patients who've reached the 6-month follow-up period, so we're still collecting that data, but 5 of 12 still meet criteria for remission, being depression-free, at the 6-month follow-up period. So I think in anyone's book, quite promising, not in any way conclusive. It's an open-label trial, relatively small sample size, but even so, I think quite promising. Also, other symptom clusters that we've looked at, anxiety, significant reductions in that at 1 week post-treatment. I don't have all the data for 3 months, so I've only looked at the 1 week post-treatment data. I was actually doing this afternoon, quite busily, making these charts. Anhedonia, so the inability to experience pleasure, which is something that's very characteristic of depression, seeing reductions in anhedonia. Post-treatment, also rumination, another aspect of the symptomatology of depression being significantly decreased post-treatment, and also dysfunctional attitudes, which is a kind of measure of trait pessimism. So related to pessimism, we've included a scale of optimism. Of course, the inverse of that is pessimism. And we found a significant increase in subjective optimism, perhaps unsurprising in the sample. We have patients saying things like, my outlook has changed significantly. I'm more aware now that it's pointless to get wrapped up in endless negativity. I feel as if I've seen a much clearer picture. But subjective optimism is one thing. How can we look at a behavioural measure of optimism, pessimism? So what we've done is to, inspired by the work of Strunk, used their approach referred to as the prediction of future life events task. And so this involves issuing patients with 20 different potential life events, and they essentially predict the likelihood of these different events happening within the next month. And at the end of the month, they tell us whether those things did actually happen or not. And so it's a way of kind of ascertaining whether they have perhaps a pessimism bias, which is quite characteristic of depression. Originally, actually, it was used by Strunk to look at this idea of depressive realism, that perhaps depressed patients are more accurate in their appraisals of the world, that ordinarily we're too optimistic and happy-go-lucky, and we're a bit sort of stupid in that way. And there's only so much that idea is only so true. And actually Strunk has done some nice work around that, because he's shown that, yes, granted there is a natural optimism bias in healthy people, but actually in clinical depression, there is a genuine pessimism bias. So people are, in a way, delusional in their beliefs that only bad things are going to come to them and nothing good will come to them. And that's something that was endorsed when we looked at our patients' performance, if you want, on this prediction of future life event scale. At baseline, it's quite strong pessimism bias. Here would be a sort of accuracy, no bias. And so you see a kind of normalisation occurring post-treatment with psilocybin. Incidentally, when we looked at, so that the prediction of future life events scale is separated into 10 desirable items and 10 undesirable items or life events. So a desirable one would be something like, I'll be invited to a party within the next month. So you estimate the likelihood of that happening. And then another one might be, an undesirable event might be something like that you'll be a victim of a crime. And actually, when we parcellated this up and chopped this up and looked at the different effects on desirable and undesirable events, we found that it was those desirable, the bias was strongest for the patients at baseline for the desirable events. So patients were believing essentially that nothing good comes to them. And that was quite strong at baseline and then normalised quite significantly post-treatment. Another thing that we've looked at that's interesting more broadly in terms of psychedelics and their effects on the mind and behaviour is personality. And this is a chart that I'm grateful to David Nutt, who's with us at Imperial, a Danish clinician and neuroscientist, and finding significant changes in 4 of the 5 major personality domains. So a couple of studies, including one by ourselves, has found increases in trait openness after exposure to a psychedelic. Perhaps most impressively, this has been shown by the Johns Hopkins team, where over a year on from a single experience with psilocybin, there are enduring increases in this personality trait, openness. And this was quite a major result, really, because in adulthood, personality shouldn't really change unless there are some major life event that would force a change. And yet, to see these increases in openness were quite striking, therefore. What we're seeing in this patient group is perhaps a kind of normalization to an extent of personality, a drop in the neuroticism that would, of course, be characteristic of depression, perhaps a normalization of the introversion that's characteristic of depression, that withdrawal from the world, but also an increase in openness consistent with the other work, and also an increase in conscientiousness, which is interesting. So this idea of the disorganized hippie isn't really supported, at least by this finding in this patient group. Agreeableness didn't change. Now, you know, all this stuff kind of forces us to think about what are the mechanisms underlying these changes, and really this is the kind of holy grail, perhaps. You know, what's going on in the brain to explain these really quite interesting and often quite challenging psychological effects. And so one idea, one analogy for what's going on is that the brain's being affected in a way that's analogous to a kind of resetting of the mind and the brain, sort of rebooting of the system. If we think of depression and the mind falling into pathological patterns that have become reinforced, then with a psychedelic we could sort of, you know, shake the system up and introduce this period, this transient period of entropy that might lead to processes of plasticity and flexibility that can contribute to the breaking of these pathological patterns. Another idea, well, this is well supported, that these qualities of flexibility and plasticity in the mind and the brain is mediated by serotonin 2A receptor agonism. And I think there's potentially a lot of work to be done around that. So this plastic state where the patient is sensitive to change, and I think that's worth thinking about carefully. And again, what we could do with that is think of the infant state, that in the infant state you have a creature that's very vulnerable and needs to be nurtured, needs to be looked after. And similarly, when we do our therapeutic work with psychedelics, we treat our patients in that same nurturing, caring way, and it's very important that we do. And arguably, it's not as simple as just a reset, because if you had an aversive environment, then the patient potentially could go on a negative trajectory and could go, for example, from health into pathology. So the importance of mediating the experience seems to be, at least theoretically, very important. And these lasting changes in outlook seem to be characteristic, certainly, of the changes in our patients treated for their depression. The role of insight, that's something that's worth picking apart. Difficult to know how important that is. Sometimes we have our patients report certain revelations that can actually be troubling to them. There can be that challenge around the notion of false memory, to think whether these are actually veridical memories or not. And so our approach is to treat it as sort of symbolic, but nevertheless psychologically meaningful and something to talk through. For example, perhaps I shouldn't go into it, but a traumatic memory that a patient reported that troubled him after the treatment, and suggested to us the importance of ongoing integration and psychotherapeutic work after the experience itself. Incidentally, he's doing pretty well at the moment, so that's good. So the idea of a healthier, more balanced view of the self and the world, this analogy of an overview effect, and that's kind of what I tried to do with this image in the background. So the overview effect is what astronauts report when they go up into space, look down on the world, and they think, why am I so obsessed with how terrible things are and my wife being annoying or whatever. They get a broader perspective on things and a broader picture. And so I think something analogous to that overview effect seems to be what's happening in our patients. And another thing that people keep asking me about, and I know is very important, it seems to be such a busy time and I haven't got around to doing it, is to look at the relationship between ego-dissolution and the therapeutic outcomes. We're making inferences that this is essential. Of course, it's important to look at the data and see if that's supported. Now, I've got these images here, and these are sort of hot off the press. This is looking at medial prefrontal cortex functional connectivity. So if you look at that during baseline conditions or post-treatment, and this is 1 day post-treatment, that post-image here, 1 day post-treatment. So that period that these recreational users of psychedelics refer to as that period of afterglow. And what we've actually seen is slightly surprising for us. We thought we might see a sort of residue of the disintegration that you see acutely under a psychedelic within this network, which is essentially the default mode network. But then you've got to think, people come down from the experience and the next day they're not tripping. When they come down from the drug, they're not in the psychedelic state. They're in some other state. They might describe this sense of calm. I think I provided some quotes that talk to that, a feeling of sort of greater headspace. I just wonder, these are regions that are not quite part of the default mode network at baseline, they're proximal to it, and I just wonder whether there's something relevant here in terms of that notion of a greater sort of headspace post-treatment. Supporting that, when we did a binary split, we found that it was those responders who showed this effect, and non-responders didn't show this kind of expansion of default mode network, spatial expansion of default mode network, functional connectivity. We looked at correlations, it was borderline significant, but that binary split, there was a relationship there. Okay, well, there's something, almost just a few more slides here, and this is where it gets really challenging and perhaps a little dangerous even. But you have to think, if this story sounds really quite promising, doesn't it? And say, what's going on here? Why are these compounds being controlled and not being exploited for their potential benefits? So why might society oppose these kind of changes that I'm describing based on our empirical work and others? Well, one thing that I sort of stumbled across really was this relationship between trait openness and liberalism. I can't quite remember how I found this actually, but I've talked about increases in trait openness that have been found with psychedelics. It just led me to sort of contemplate the question whether there may be associated changes in political perspective after exposure to a psychedelic drug. And so, it's often is the way, if you want to sort of sample things in a quick way, you can run an internet survey. It's not going to tell you anything about causality, but it might support a general principle and motivate a controlled study. And so that's kind of what we've done. So we gave people a classic measure of liberalism. It's just a simple VAS scale with conservatism, I think very conservative at one end, very liberal at the other, so quite crude. But nevertheless, we saw a relationship between extent of psychedelic drug use and liberalism. Well, that might be no surprise, maybe it's just something around drug use. But the relationship was selective. It wasn't there for cocaine, and it wasn't there for alcohol. So that was interesting. We also saw a relationship between nature-relatedness, which is a measure of sort of concern for the environment. An example item in the scale is I always think about how my actions affect the environment. So perhaps, no surprises there again. The happy hippie who loves nature and the environment. A positive relationship there between psychedelic use and nature-relatedness. What was intriguing and something that we didn't really expect, perhaps because we hadn't thought about it thoroughly enough, was that there was a relationship between alcohol use and nature-relatedness, and this was a negative relationship. So the more people drink, the less they seem to care about the environment. So what's driving this change? Well, I talked earlier about the selective relationship between psychedelic dose for psychedelic and ego-dissolution. and that's something that may be selective to psychedelics, so maybe the experience of ego-dissolution is important for these subsequent changes. So that's something that we've been looking at in a sort of update of this analysis. Matthew Knorr at Imperial, a very clever young clinician and academic, has been looking into this and looking at different factors that might associate with the magnitude of ego-dissolution experienced under a psychedelic. And in this survey, we asked people to refer to their most intense psychedelic experience and then to report the magnitude or the degree of ego-dissolution within that experience. When they did that, we found positive relationships between what you might call anti-authoritarianism. Now, this scale, this authoritarianism scale, includes 5 items. It's borrowed from a British survey. One of the challenges of political perspective is that certain things like liberalism, what it is to be a liberal, can be different in different countries. So sometimes it's interesting to just ask people's opinions on certain policies or issues in society. And so an example item here is that people who break the law should be given stiffer sentences. So if you score highly on that, you would score higher on this authoritarianism. It's all sort of roughly, it's related, I think, to conservatism. So anyway, ego-dissolution was positively associated with anti-authoritarianism, or negatively associated with authoritarianism, positively associated with liberalism, positively associated with nature-relatedness, and also with openness. Just for brevity, I didn't focus on the other things, but it's interesting perhaps that age related negatively to anti-authoritarianism, or rather positively with authoritarianism. Perhaps no surprises there, but quite interesting. Education, being in an academic environment, it's interesting actually that the opposite is true for education. The more educated you are, the more anti-authoritarian, probably because you're questioning things. Also, the more liberal. A lot of things that are quite sort of intriguing here. But the essential thing that I wanted to communicate to you is this relationship between ego-dissolution and these quite interesting changes in psychology that may be enduring and may be a causal effect, potentially, of psychedelics. So that's a challenging idea. That's something that could motivate a control study, and of course it is quite a scary idea, perhaps. But science is all about asking difficult questions and testing them. And so if we adhere to that principle, then I think we should test it. So we started to sort of do that, really. We started to do it towards the end of the depression trial. I wanted to include this authoritarianism measure, so we put it in for the last 6 patients, and lo and behold, it was a significant effect. In just 6 patients, we saw a decrease in authoritarianism 1 week post-treatment. What will be especially interesting is to see whether this endures 3 months post-treatment, and of course to do some further work on this, because this is a kind of loose sort of preliminary pilot investigation of this idea. And a relationship between nature-relatedness. You can see there's a bit of a ceiling effect going on there. Our sample were already pretty high, so 30 is the maximal score on this nature-related scale. It's just a 6-item short scale, but nevertheless validated. But we did see a significant increase in nature-relatedness. And so all this stuff leads me to sort of conclude with the question, really, or to end with the question of, we covered some really quite high-level psychological ideas here and philosophical ideas. Yet all this stuff we can trace back down to the molecular level, and a particular class of molecules that stimulate a particular serotonin receptor in the brain. And so I think scientifically that should lead us, first of all, to acknowledge that that's interesting and potentially important, and then to ask what it is about these receptors. How do they function ordinarily? Why are they there, and what do they do? And I think if we think about that in the context of some of the work that I've described, then maybe they're there for change. Maybe they're there for the kind of change that is fundamental, that is perhaps enduring at times. And it's interesting, I think, to also consider that perhaps these states that most reliably causes a release of serotonin in the brain is stress or trauma. It will broadly release monoamines, but certainly a very marked release of serotonin, and perhaps under those conditions, these receptors are going to be more likely to be stimulated, and that may lead to interesting changes in outlook and behaviour occurring naturally without the exposure to psychedelic drugs. So I started with a quote, and I'll end with a quote, and this is from George Bernard Shaw, the Irish playwright, and it says, "Those who cannot change their minds cannot change anything." I'd just like to end by thanking the broad team that have contributed to doing this work, and it's very much a team effort, headed by David Nutt, who I've worked with now for the last 10 years, the depression research supported by the Medical Research Council, and a lot of our brain imaging work, in fact the vast majority of it, supported by the Beckley Foundation, and particularly the very hard work of the director of the Beckley Foundation, Amanda Fielding. So with that, I'd just like to thank you for your attention, and I hope there's time for some questions.